The new generation is the slave of electronics. अब ये नया चमत्कार AI आ गया. People using AI more had their brain function reduced by 30%. What is the second largest cause of cancer in the world?
Probably pollution, probably
obesity. Obesity is the second largest cause of cancer. An obese patient has 8-fold more chances to get a uterine cancer, cervical cancer, and breast cancer in ladies, and colon and stomach and prostate cancer in males.
Welcome to season 2 of Health Charcha with Medtronic, the podcast where we simplify healthcare, share real-life experiences, and dive deep into breakthrough treatments. I'm your host Kartik, and today we are focusing on a condition that impacts 13% of the adult population, with 1 in 5 children and adolescents that are aged between 5 to 19 years. We are talking about obesity. अगर हम इंडिया के बारे में बात करें तो obesity is becoming a rising public health concern with an increasing number of adults and children struggling to manage their weight. इस एपिसोड में हम डेडिकेट करने वाले हैं अपनी अंडरस्टैंडिंग को कि क्यों obesity is a disease not just a matter of poor lifestyle choices, और हम ये भी डिस्कस करेंगे कि इसके पीछे की साइंस क्या है, इसके पीछे के जेनेटिक्स क्या है, इसके पीछे के एनवायरमेंटल फैक्टर्स क्या हैं जो कंट्रीब्यूट करते हैं ओबेसिटी को, और कैसे अर्ली इंटरवेंशन इज क्रिटिकल फॉर बेटर हेल्थ आउटकम्स. Joining us today is Dr. Atul Peters, who is globally recognized bariatric and metabolic surgeon with over 2 decades of experience. I mean, you have the amount of experience. 20 years is really huge, because if we talk about 20 years, we were really small. We in fact had no clue about how the world even runs. So he heads the Department of Bariatric, Minimal Access and General Surgery at Max Smart Super Speciality Hospital, New Delhi. A surgeon of excellence. You have been accredited with a Surgical Review Corporation by the United States of America. And you perform 300 advanced laparoscopic procedures annually. That's actually a number. Welcome, Dr. Atul FC Peters. Thank you so much for being here, for sparing your wonderful time.
It's a pleasure.
We are going to talk about a certain disease that is being ignored by a lot of people in these times. क्योंकि सर ये जरूरी भी इसलिए क्योंकि लोगों को ऐसा लगता है it's all about lifestyle choices.
Yeah, but you know what? Like when I started, right? I've been practicing for more than 30 years, and I've been doing bariatrics for close to 20 years. When I started my practice, ज़्यादातर लोग बाहर से आते थे सर्जरी कराने because it was extremely expensive out there.
Correct.
Right? So over the last 2 decades, I've seen a shift of my practice. Earlier, less than 10% of my patients were Indians. Right? Now, over 90% of my patients are Indians. So there is a dramatic shift. People have recognized obesity as a disease. And the last few years, right, it has really, the acceptance has increased. So, क्योंकि acceptance increase हो गई, तो अब अगर मैं यही नहीं मानूंगा मैं बीमार हूँ, तो मैं इलाज कैसे करने जाऊँगा? तो अब लोग मानने लगे कि obesity बीमारी है और उसका इलाज बहुत ज़रूरी है.
Sir, there are studies which actually shows कि obesity is not just simply about overeating, कि आप क्या खा रहे हो, कैसे खा रहे हो, या आपका lifestyle कैसा है. There are a lot more issues to it. There is a sense of, I don't know about the better word, how to say it. A lack of willpower can be one of those terms that we can actually use. But multifaceted conditions भी हैं जहाँ पे genetics का भी बहुत बड़ा role होता है, environmental conditions का भी बहुत बड़ा role होता है. I really want to ask you, why is it a disease? And why nobody is really accepting this in a full-fledged manner?
So number one, it is a disease because the largest organization of the world, WHO, classifies this as a disease.
Okay.
So WHO says obesity is a disease. It is a disease, right? Number one. दूसरी बात अगर हम ये देखें कि बीमारी मोटापा सिर्फ एक वो इशू नहीं है कि आप मोटे लग रहे हैं. उसके साथ जुड़ी हुई इतनी ज़्यादा बीमारियां हैं, इतनी ज़्यादा कि अगर मैं आपके सर से नीचे तक चलना शुरू करूं, स्यूडो ट्यूमर यानी कि सर में दर्द होना, हैवीनेस होना, क्लस्टर हेडेक्स, डायबिटीज, 80% of obese people will get diabetes, right? Hypertension, retinal impairment, कैरोटिड में एथेरोस्क्लेरोसिस प्लाक होना, नीचे आ जाओ हार्ट में कार्डियोमायोपैथी होना, CAD होना, एंजियोपैथी होना, किडनीज पे इफेक्ट होना, लंग्स पे इफेक्ट होना, इनफर्टिलिटी होना, आपके पैरों में सूजन आना, डीप वेन थ्रोम्बोसिस होना. इतने ढेर सारी बीमारी से जुड़ी हुई हैं कि ये एक बीमारी नहीं है, ये बीमारी की जड़ है.
करेक्ट.
तो अगर हम एक मेन प्रोसेस को ठीक कर पाए और समझ सके कि मोटापा हो क्यों रहा है और सबके मोटापे के कारण अलग होंगे.
Correct.
सिर्फ like what you said, right? Eating is just one bit of it, right? Now I don't remember any one patient coming to me and saying I eat a lot so I'm obese. Never, right? They always say मैं तो सिर्फ 2 रोटी खाता हूँ, 2 ये करता हूँ. They will, so no one really accepts that they overeat.
Okay.
Number one, it's like saying, if you ask someone who's met with an accident, will he ever say, I was drunk and watching my phone, I was driving fast, met with an accident?
Nobody.
Never.
Nobody will.
No one will accept it.
Exactly.
Similarly, eating is just one bit of it. There is a lot more to it than just eating.
Sir, there are times when people don't, like you rightfully said, कि लोग नहीं मानते हैं इस चीज को कि ये इसका कारण है. Genetics involved है, environmental factors involved है. The kind of generation that we are a part of now, because you know we live in the era of these smartphones. Everything is available on a 7-inch or a 14-inch screen.
Oh, absolutely.
And you know, all of these slangs that come into the market when people say, "Oh, we are the Gen Zs or the baby boomers or the millennials of the world." हम लोग ये बात भूल जाते हैं कि genetics का, lifestyle का, environmental factors का कितना बड़ा रोल है और कैसे लोग ससेप्टेबल हुए जा रहे हैं टुवर्ड्स ओबेसिटी. तो उस पे अगर we can shed some light upon this.
So number one, if you see, genetics plays extremely important role because इसको समझना बड़ा आसान होगा कि आप एक घर को ले लीजिए. एक घर में एक माँ बाप के 2 बच्चे. तो जेनेटिक्स सिमिलर हुए, सेम नहीं है.
सिमिलर हुए.
नाउ जेनेटिक्स सेम होना और उन जीन्स का एक्सप्रेशन आप पे होना और मेरे पे होना अलग है.
करेक्ट.
राइट. सो जेनेटिक मैटर, उनका एक्सप्रेशन. सेकेंडली एनवायरमेंटल फैक्टर्स. एक ही घर में एक खाना बनता है, दोनों सेम खाना खाते हैं, राइट, बट एक मोटापे से पीड़ित हो जाता है, एक दूसरा नहीं होता. सो देयर आर एनवायरमेंटल फैक्टर्स. नाउ एनवायरमेंटल फैक्टर्स कुड बी हाउ यू यूटिलाइज योर एनर्जी, राइट, हाउ एक्टिव यू आर, or the type of food that you eat. Also, normally food in terms of lunch, breakfast, dinner doesn't cause obesity as such. It is the snacking which is important. हम उसको नहीं मानते.
Correct.
हमने चाय पी, चाय के साथ 3 बिस्किट खाए, वो तो कुछ भी नहीं था ना. वो तो मैं सुबह उठ के मैंने 3 बिस्किट खा लिए. उसको कोई नहीं गिनेगा. Without realizing, to burn those 3 biscuits, you need to run for 5 kilometers. To burn 3 biscuits, you need to run for 5 kilometers. So वो एक्सेस कैलोरी क्या हुई? जमा हो गई. उसके अलावा जो अब और न्यू रिसर्च आ रही है वो गट माइक्रोबायोम के बारे में बहुत आ रही है. Correct. कि जो आपका जो इंटेस्टाइन्स में जो फ्लोरा है, फ्लोरा मीन्स जो आपके अच्छे बैक्टीरिया है या जो दूसरे बैक्टीरिया हैं, उनका असर हमारी हेल्थ पे कैसे होता है, वो हम फैट कैसे स्टोर करते हैं. तीसरी चीज हमारे हार्मोन्स कैसे प्ले करते हैं. अब आपने कई बार सुना होगा यंग गर्ल्स कहती हैं मैं मोटी इसलिए हो गई कि मेरे को पीसीओडी है. It is just the opposite. मोटापा causes PCOD. PCOD doesn't cause मोटापा. Right? But हम आपको एक excuse मिल गया. Second excuse, मेरे को thyroid है इसलिए मैं मोटा हो गया. Thyroid doesn't cause obesity. Only extreme of hyperthyroidxicosis or hypothyroidism can cause obesity. So largely less than 5% of your overweight is attributable to thyroid. Rest is your eating. So genetics, presentation of the genetics or expressions of the gene, your hormonal imbalance, the type of physical activity that you do, the type of food that you eat, the gut microbiome, all these are small things which make a lot of difference. Along with that, जैसे hormones होते हैं, कोई लोग suppose हम दोनों बैठे हैं, maybe अगर हम रोज के 4 गुलाब जामुन खाएं, maybe you will gain 2 kgs in 2 weeks, I'll gain nothing. So how much do you burn at rest? The BMR. So some people are natural burners. They will utilize higher energy than the other person.
Correct.
So even if you're eating the same food, same environment, same exercise, you may still get obese if your metabolic rate is slightly slow. And then there are again so many other factors which can increase or decrease your metabolic rate. So these are broadly few things that one should understand, that motapa is not just eating more. It has all these important factors.
Sir, one more thing that I really want to follow up on is the lifestyle. Lifestyle बहुत drastically change हो गया. We are living in the era where everything is available on a single tap. Like even if you need food, you just can order it on a food delivery app, or you can just book a cab. You don't have to go anywhere. So physical activity actually lower कम हो गया. And if we talk about this current generation who are basically teenagers or who are about to be adults, उनका physical activity कितना है कितना नहीं है compared to the people who have lived this era is very less.
Oh yes.
Like the kids of this generation don't really go out and play soccer or cricket. They are busy playing a lot of games on their phones or on their PlayStation or their consoles. And because of this lifestyle change, a lot of people are actually getting confused whether we are overweight or whether we are obese. What's your take on that?
So number one, if you remember, there used to be a very beautiful ad called दाग अच्छे हैं. Right?
Yeah.
उसमें बच्चे खेलते थे.
Correct.
उनके कपड़े गंदे होते थे, आते थे जाते थे. तो आज के एरा में तो ना दाग है ना अच्छे हैं. बच्चे बाहर ही नहीं जाते. हमारे टाइम में I remember we used to throw our bag and go out.
Yeah.
Parents didn't even know where we are. They knew कि भूख लगेंगे तो आ जाएंगे. आजकल everyone is sitting either with their phones or their laptops.
Yeah.
Secondly, the so-called Gen X are into the real life, not the real life. मेरे इतने likes हैं, मेरे इतने followers हैं. How does it matter? You don't have physical friends, right? So we are all getting into, and they have made us their slaves, right? So the new generation is the slave of electronics, right? Media. अब ये नया चमत्कार AI आ गया है, right? So लोग AI के slaves बनने जा रहे हैं. There's a very recent study which came out which says they did a Harvard study wherein people using AI more had their brain function reduced by 30%. This is I think day for yesterday.
That's a very recent survey that was being done by Harvard.
I saw that. And so Norway में they have stopped using iPads for the schools. They've done a research which shows that people or the kids using these tablets and everything produce less amount of intelligence, right, than when they used to go to blackboards and physical books, right? So they have switched over to normal blackboards and physical books. So physical exercise is extremely important, extremely important for all the kids, right?
Correct.
Third thing, everything is easy, right? Prehistoric time, what used to happen? We used to hunt food.
Yeah.
Right? Lot of physical activity, less amount of food, right? Today, no physical activity
and a lot of food,
right?
Correct.
Then the type of food. You order a bowl of salad, $500.
Yeah.
You order a fried potato or something, $50.
Yeah.
So wrong food is cheaper, right? Plus, in our subcontinent, we do not have a prerequisite of all these food giving the amount of calories and the fats that they are supposed to do. Abroad, it's almost a mandate. Even in a wrapped food, they are supposed to write how many calories and everything.
Yeah.
So the food is becoming easy, and the type of choices that we have is going bad.
और सर एक बहुत ही ब्लर लाइन है बिटवीन बीइंग ओबीस एंड बीइंग ओवरवेट. शायद ये लोग मानते नहीं हैं कि जैसे लाइक हाउ यू राइटफुली सेड कि जरूरी नहीं है कि ओवरवेट है तो ओबीस है.
नहीं, देयर इज अ क्लियर कट डिस्टिंक्शन. सो अगर हम इसको माने तो बहुत सरल तरीका है BMI इज बॉडी मास इंडेक्स. सो आप अपना वेट लेंगे किलोग्राम्स में डिवाइडेड बाय हाइट इन मीटर्स इनटू हाइट मीटर स्क्वायर, राइट? सो अगर आपका BMI 17.5 से लेके 22.5 तक है, दैट्स टेकन एज नॉर्मल.
Okay.
So 7.5 to 22.5 is taken as normal. Beyond 22.5, 22.5 से ऊपर आप लेंगे तो हम उसको overweight कहते हैं, not obesity. We call it overweight. जैसे ही आप 27.5 के ऊपर चले जाते हैं, तब हम उसको obesity मानते हैं. Right?
Okay.
तो 27.5 के ऊपर क्लास 1, 32.5 के ऊपर क्लास 2 और 37.5 के ऊपर क्लास 3, जो अब recent guidelines में फिर 2.5 रिड्यूस कर दिया है. तो अब 25 के ऊपर ओबेसिटी मानी जाएगी. सो इफ योर BMI is more than 25, you are class 1 obese. More than 30, you're class 2 obese. More than 35, you're class 3 obese. For Asians.
Okay.
Right? For Americans, it's still about 30, 35 and 40. But we have reduced it by 5 BMI points for Asians because what we've seen is diseases attract us much more quickly and at a much lower BMI than this. And secondly, BMI का थोड़ा सा fallacy क्या है? Because it's taking weight. It's not actually taking the bone weight and the muscle mass and the fat weight. Yeah. So if you see a 6 feet tall American, he may be 120 with a BMI of just 25, 30 with a good amount of muscle mass. Vis-a-vis an Indian who is just 80 kgs at a 5 feet with a body fat percentage of 40% and they'll be class 3 obese. So it's body fat percentage which becomes extremely important, correlated with the BMI. So as I said, till 20, okay, 25, 30, 35. Class 1, class 2, class 3.
going back to our conversation, you said that now WHO, World Health Organization, उन्होंने भी ये मान लिया कि obesity is a disease.
Oh yes.
How important is it for each and every citizen and humans out there to understand that this is actually a disease and not just a lifestyle issue? Because at this point of time, a lot of people can just throw around tantrums like they are throwing their visiting cards on the crossroads, saying कि यार lifestyle है, मैं corporate में काम करता हूँ, my work hours are really terrible, and because of that मैं midnight snacking कर लेता हूँ कभी कभार, मैं बाहर नहीं जा पाता, physical activity नहीं हो पा रही है. A lot of people blame their lifestyle choices out of it. But now that the WHO has recognized obesity as a disease,
Oh yes.
how important is it for everyone out there in the world to understand that, boss, this is the time. This is an actual disease and you should recognize it as a disease.
I can't put a lot of stress, and I have repeated this frequently whenever I speak, that number one part of getting corrected something is acceptance of the fact that you need correction. मैं डॉक्टर के पास तब जाऊंगा जब मैं मानूंगा मैं बीमार हूँ. अगर मैं मानूंगा ही नहीं मैं बीमार हूँ,
करेक्ट,
तो मैं कैसे जाऊंगा? मैं अपनी कार को वर्कशॉप तब लेके जाऊंगा जब मानूंगा कि उसमें एरर आ गया है, राइट? अब मैं यही मान लूँ ये तो नॉर्मल है.
करेक्ट.
इफ माय कार गिव्स एन एवरेज ऑफ 5 ये तो नॉर्मल है. इफ इट्स थ्रोइंग ब्लैक फ्यूम्स ये तो नॉर्मल है. सो द थिंग इज दैट मोस्ट ऑफ अस एक्चुअली डू रिकग्नाइज इट, राइट? हमको पता है क्या राइट है क्या रॉन्ग है, हमें पता है. Right, and with this knowledge, everyone really knows what is BMI. As I was saying, 20 years before, when I used to tell someone that there is something called bariatric surgery, and you must think about it, they used to be like looking at me and says, "बोल क्या रहा है? मोटापे की surgery? What are you saying? ये क्या होता है?" Right? Today, people come to me asking for dates for surgery. So it has changed. People today recognize that they are obese. They would have tried almost everything in terms of diet, exercise, and they must have joined a few dietitians here and there, and they recognize that it has gone beyond it, so they need it. So it's extremely important to recognize and accept. Recognize without acceptance, no use. You will never go to anyone for help. So we need recognition and acceptance that I need help. And once you recognize and accept you need help, that is the time you actually won half the battle.
Correct.
So that's what I would say. सब लोगों को पहली बात मोटापे को एक्सेप्ट करिए कि अगर मुझे मोटापा है तो मोटापा है. दूसरा, मोटापा एक बीमारी है. अब अगर मैं ये मान लूँ मुझे मोटापा है और मोटापा एक बीमारी है, तब मैं उसके इलाज के लिए जाऊँगा. तो acceptance becomes very important.
Correct. Let's talk about these little things now. I mean, what's a typical scenario or an interaction where weight stigma that we typically talk about might be present without us consciously registering it as like a problem? तो ये अगर ये weight stigma है, अगर हम इसको consciously नहीं बता पा रहे हैं, register नहीं कर पा रहे हैं कि एक problem है, तो ये typical scenario कैसा होगा, मतलब for an individual?
I think it's the start of a very bad journey, I would say. Once you understand that, then what has happened is, it's like you know that your car has a flat tire, right? Now you don't want to accept it. There is a warning sign coming on the screen that check your tire pressure. You ignore it. What happens next? It will run flat.
Yeah.
After a while, the rims will go bad. After some time, you'll catch fire. So one is ignoring the fact. Second is accepting the fact. If you start ignoring it, जैसे मैंने पहले बताया हमारी बीमारियां, you will 80% chance that you will get diabetes, right? Infertility in males and females. It's an extremely big issue.
Correct.
Infertility, right? Then swelling in the limbs, right? Joint pains, backache. These are so important issues, right? Especially for the youngsters, right? Infertility becomes an extremely big issue. Very big issue. So I see youngsters in the age group or the reproductive age between 20 and 40 with infertility. And when you actually point out that it is because you're obesity, they don't accept it. Okay. They are not willing to accept it, right? So एक बार अगर हमने मान लिया कि मोटापा है, तो उससे जुड़ी हुई सारी प्रॉब्लम्स को हम जूझ पाएंगे, ठीक कर पाएंगे. Now, I ask everyone, what is the largest cause of cancer in the world? So if I ask you, what is the largest cause of cancer? You'll say smoking, tobacco use, right? What is the second largest cause of cancer in the world? I guess.
Probably pollution, probably obesity.
So obesity is the second largest cause of cancer. An obese patient has 8-fold more chances to get a uterine cancer, cervical cancer, and breast cancer in ladies, and colon and stomach and prostate cancer in males.
Okay.
So imagine the risk that you're taking when you're not accepting it. Plus cardiac ailments. Then OSA, सांस की बीमारी, right? When you talk to them, they said, हाँ हमें खराटे तो आते हैं, but वो तो बहुत लोगों को आते हैं. अब खराटे लेना बीमारी नहीं, बिल्कुल बीमारी है. There's something called obstructive sleep apnea, right? And motapa is one of the largest cause causing this, right? And you would not know. You must have heard sometimes people saying, कल तो ठीक था यार, सोते सोते चले गए. So this is OSA, right? If you have a cardiac arrest or if you have a heart attack or there's an arteries blocked, if we get 30-40 minutes, right, we can still revive it.
Correct.
Right? But if you don't breathe for 2 minutes,
dead.
Right? So OSA is another thing. So acceptance is extremely important. Once you accept, फिर आपको मालूम चलेगा इससे जुड़ी बीमारियां क्या है और फिर आप उसका हल ढूंढने चलेंगे.
So before I move towards our next segment, that's actually about busting some myths about obesity. One personal question, and this is actually when I personally observe the society that is around me. We don't realize this very often. हम जब अपने घर में भी होते हैं, हम ऐसे किसी फ्रेंड सर्कल में भी होते हैं, एक सेफ स्पेस में होते हैं. People have a habit of fat shaming, their friends. कभी कभार वो उसका इम्पैक्ट शायद हमें रियलाइज नहीं होता है. काफी सारे इंडिविजुअल्स को भी शायद वो नहीं कर पाते हैं उस टाइम पे. उन्हें लगता है दोस्ती तो बोल रहा है, फैमिली तो बोल रही है. बट साइकोलॉजिकली इट ऑल्सो हैज अ वेरी पिवटल रोल.
Oh yes, absolutely.
एंड nobody really talks about it because ऐसा लगता है कि यार he is just my friend, he is my family member, he is roasting us. So everyone's talk about the medical aspect of it, how it can be cured, how it can be diagnosed. But nobody really actually talks about the psychological impacts and the emotional setback it gives to an individual, and he feels like ये हो गया मेरे साथ. But वो बहुत late realize हो रहा है.
50% of people who are obese suffer with depression. Right? And depression itself can cause obesity because you go into binge eating. Right?
Correct.
Our satiety center and our depression center in the brain are close knit. Right? So when we are feeling depressed, you tend to eat more.
Yeah.
So obesity also causes depression, and depression itself can cause obesity because you would not want to go out. Social, when you go out, and it's not just your family or friends. Imagine you go for a parent-teacher meeting, or a school's kid, and his friends keep on saying, "उसके पापा कितने मोटे हैं देखा तूने?" And that's truth. So these people, they stop socializing sometimes.
Correct.
Right? They don't want to go out because they understand. यार स्कूल में मेरे बच्चे के फ्रेंड्स उसको चढ़ाएंगे कि उसका बाप या उसका मामा मोटी है. So that's a big problem. Air travel. When you're going on air travel, probably you will not sit in an economy seat. Why? Because you will not fit into that.
Yeah.
Second, asking for an additional belt. Ma'am, can I have a belt?
People get a little hesitant about
going for shopping. Do you have 7XL with you? Do you have 4XL with you? Right?
Correct.
So these are social stigma. ये तो बहुत बड़ी बात हो गई अपने आप में. Tying your shoelace.
Yeah.
Right? Cleaning yourself after going to the washroom. Bathing. Right? Sitting on a small chair where you go out and you don't have a heavy chair. And you suddenly say, will this take my weight? Right? So social shaming, yes, it comes. And but that's the society that we live in.
Yeah.
Right? And so I'm not saying it's good. It's extremely bad to shame someone in terms of the physical appearance. But if someone does, I think it can be converted into a positive feedback from the other person. If someone says you are mota, right? I think it's a time that you do a cross check, go figure out your BMI and say, oh yeah, he was probably right. And again, the same thing, acceptance.
Yeah.
So realize it, accept it, go for the remedy. So that's what should be done.
Correct. So now let's move to the next segment that's actually about busting some myths about obesity. And काफी सारे myths होते हैं सर जो contribute करते हैं towards the stigma. And आज 4-5 हमारे पास ऐसे myths हैं जो मैं चाहता हूँ कि आप clear करें on this podcast. The first one is actually obesity is just a matter of overeating and laziness. और ये आप लोगों ने बहुत सारे Google forms में कोरा पे कोट्स में ये चीज पढ़ा होगा जहाँ पे लोग रैंडमली आके सारी बातें बोलते थे, तो पीपल आर सेइंग दैट इट्स जस्ट अ मैटर ऑफ ओवर ईटिंग एंड लेजीनेस.
No. So it is not just the matter.
Correct.
Overeating and laziness will contribute, but are these the only sole factors? Wrong. So ज़्यादा खाना और सुस्त होना contributing factors हैं, but ये नहीं है कि सिर्फ इनसे होता है. जैसा हमने पहले डिस्कस किया था, there are genetic factors, there are environmental factors, there are social factors, there are emotional factors. All these plus how your body reacts. तो कुछ लोगों का BMI high होता है, they can burn more. कुछ लोगों का low होता है. फिर किसी का मसल मास ज़्यादा होता है, तो they can actually burn more fat. So physical self, hormonal imbalance, genetics, genes, how they behave on you, all these, and then of course the gut microbiome which we talked about, ये सारे कारण हैं मोटापे के. तो सिर्फ ज़्यादा खाना और लेजी होना नहीं, बट वो बहुत इंपॉर्टेंट चीज़ें हैं, बट वो कंप्लीट नहीं है स्टोरी. इसके अलावा बहुत सारे फैक्टर्स हैं.
And what if obesity only affects people who have very poor eating habits? Just poor eating habits.
So I would say because eating habits contribute to a very large chunk of people who are obese. So if this way is true, the other way may not be true. That means overeating will cause obesity. Almost true, but all obese people overeat may not be true. So एक तरफ true है, एक तरफ true नहीं है. क्योंकि overeating important contributory factor, but only overeating no.
Right now we live in a world where we are judged by the appearance, and obviously if you look very suited, booted up, and you are very fit, and you're not fat, you're not really healthy, you know, people say that obesity is just a simply cosmetic issue. It's not a health problem. What's your take on that?
I mean, it's in today's era where you have access to everything, and today it's, you know what, it's like saying I don't accept it. Close your eyes and say it's night. It's night. Right. It's not night, right? So in today's era, if nothing else, go on the WHO website or write on Google, is obesity a disease? You'll find out it's a disease. It's been classified as a disease. So not accepting it is like, I don't accept it. Who are you? Who am I? We are no one. There are governing bodies in the world who will define, right? So by definition, obesity is a disease today. And not just one disease, it will gather and attract other diseases like how.
One more myth that I really want you to bust. People with obesity just need to try harder to lose weight.
No, that's a myth. Now, when I see, so day for yesterday, there was a young child, the father and mother. He was obese, he was about 170 odd kgs. And they say, sir, ये बहुत lazy है, सुबह नहीं उठता. अगर ये सुबह उठ के चले मेरे साथ तो उसको कभी obesity ना. I said no, that is not the reason. That could be just one of the reasons. But ये मान लेना कि obese people are lazy people, they don't have willpower, it's false. I can show you very many people who do their level best. I have seen so many people who are probably overweight and obese going to the gym regularly. Sometimes it's your body that resists a change. See, you and me are made to gain weight. We are made to gain weight. If you again go to prehistoric times, anyone who could store had a survival benefit. So survival of the fittest. Our genes are such that we will store for the future, right? So those genes also play on us even today. We will store for the future. We will store. So sometimes your genetic composition is such that no matter how much you do, right? And some people might think you're lazy, you don't want to go out to work, blah, 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 blah. So I don't blame that all obese people are lazy people. No, they are not. Some of them really work hard, but they do not get the results. And that is the reason why there are other helps available in terms of drugs and surgery to overcome obesity in such cases.
So the fifth and the final myth that I really want you to bust is obesity is a problem only for older adults. What's your take on that?
Oh, absolutely not. We did a recent study and we found out about 3 to 7% of urban school kids were obese, right? So it is not. I have operated on kids who are 12, 13, 14, 15, 16, 17, 18, right? Other thing is 30% of parents suffering from obesity will have obese kids. So it runs in families too.
Yeah.
Number one. And second, now today's era, you see a lot of kids a lot of kids, teenagers between 16, 17, 19 and then early 20s coming out with obesity. I think one thing is, of course, the food to blame. Second is no time. Third is the real life. And so that's it.
Well, that brings us to the final segment of today's episode, Health Charcha Hotline. Here's a question that is being sent by one of our listeners, and it's also a patient. And she comes out from Delhi. Her name is Neha Kapoor. And she asks, Doctor, I have struggled with my weight for so many years, and I wanted to understand that what's your expert take on the effectiveness, risk, and ethics of fat-burning pills and injections for weight loss? Because this is a question which is viral on the internet. You see celebrities, and then there is always a drug name that pops up. That, oh, these guys are on Ozempic, or these guys are taking some fat-burning pills.
So number one, there are no fat-burning pills. Full stop.
Oh.
There is nothing called fat-burning pill.
Okay.
A few of them available are not US FDA approved, and they increase your heart rate so that you tend to burn more calories, right? So there's nothing called fat burning. Coming to a few drugs which are basically GLP-1 analogs, GLP is a basic hormone produced in our gut, which decreases the gastric emptying. That means if the food stays in our tummy for a longer time, then you won't feel hungry. It suppresses our hunger too, right? So all these drugs are primarily to reduce your hunger,
okay,
and increase the gastric motility, decrease the gastric motility. So food stays there for longer. These were originally made for diabetes, type 2 diabetes.
Okay.
And while using on type 2 diabetes with obesity, we also realized that they also have some amount of weight loss attributable to them. So then came, and of course the bigger pharma people, knowing that this is a big chunk and people don't want to go under the knife and we can really encash it, then they came up with these drugs. These drugs are not for everyone. Not for everyone. These are expensive. They have side effects. It should be done only under supervision. The catalog by these drugs clearly says the maximum effect is about 20% of your body weight, along with all the side effects, and only on subjects who were kept on a specific calorie diet while doing X amount of calorie burn for exercise, right? Correct. So if someone thinks that I don't want to go out to the gym, I don't want to do this thing, and I will just take these shots and I'll get okay, I think that's foolish, number one. Number two, the moment you leave it, you're going to regain everything back. Right? So are you willing to take a medicine for rest of your life or an injection for rest of your life, which is going to be expensive? It is as expensive as 25 to 30,000 a month. Are you ready to spend that type of money for just 15-20% weight loss for rest of your life and taking all the risks associated with these drugs? No. So the answer to this lady is, number one, calculate your BMI. If you have no other associated comorbidities like diabetes, hypertension, dyslipidemia, blah, 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 then if you're class 1 obese, try exercise, put in a regime for yourself, count your calories, start reading food labels, understand how a food label is read, take adequate amount of proteins, start burning calories while going. I'm not saying everyone is made for the gym. Pick up any sport, right? Do cycling, jogging. Now, sport doesn't mean Ludo, Carrom board. I mean, they are sport, okay, but you're burning nothing. Yeah. Right? And third is, don't get fooled by, I am doing yoga, my yoga instructor comes, right? Yoga se kuch nahi hoga. Yoga is good. I'm not criticizing yoga. Yoga is brilliant for your body, for your soul, for stretching your body. But do you burn too many calories with yoga? Probably not. So you must do some aerobic exercise. So, and if your BMI is crossed 30, and if you have associated comorbidities, do meet a bariatric surgeon. Maybe you need help in terms of either surgical intervention or drugs.
Well, thank you, Dr. Peters, for sharing such wonderful insights and telling us what are the complexities of obesity. And, people need to realize this, that it's not just about how they live their life. It's not just about the poor life choices that they have or the eating habits that they have. It has a lot to deal with. It can be genetic, it can be environmental, it can be about how you are as a human. Are you whether disciplined enough to live a healthy life, or you really don't want any of your, how can I say this, your family members to be right around your corner and telling you, dude, it's time. So thank you so much for sharing
You're most
such
welcome.
wonderful insights
You are most
on
welcome.
obesity. And for everyone who is watching this podcast, my simple request to you guys is that, make sure that you go to your doctor. You don't consider Google as your doctor.
Oh,
because
absolutely not.
A lot of things that are being written on the internet are not really true. So, well, that's a wrap for today's episode of Health Charcha with Medtronic. We hope you have gained a clearer understanding of obesity, from its causes and health risks to the best treatment approaches. If you or someone you know is struggling with obesity, remember, early diagnosis and intervention can lead to better health outcomes. Until next time, take care of your health. Be proactive about managing obesity, and remember, the right care is just a conversation away, like we just had. For more information on obesity and advanced treatment option, visit www.medtronic.com or consult a metabolic health specialist today. This is your host Kartik, signing off.